I started using crack cocaine at 15 based on loneliness and neglection.
Our addiction started with party drugs, then later turned to oxy. And before we knew it, we had a serious opioid addiction.
Former addicts in San Francisco sharing their stories of addiction and recovery. San Francisco's health department, at times criticized for not doing enough to encourage people to go into drug treatment programs, is focusing on a different kind of recovery campaign.
The purpose of this campaign is to educate people that treatment and support services are possible in San Francisco to help people with fentanyl addiction and other substance use disorders.
Today, those who have been through treatment will be featured on billboards to encourage others to seek help. The campaign features 9 people in recovery who have found success in treatment.
Because of our addiction, we didn't know that I was pregnant until I was having our daughter, Paloma, and we knew instantly that our lives had to change for her sake.
I'm certainly proof that recovery works. I know that. I know that I've been blessed with friends, colleagues, and people in my life that supports my recovery.
It does work, and treatment works. But we got today, and tomorrow we got to work on it again.
The Living Proof campaign coincides with the expansion of the city's treatment on demand program.
And ABC 7 Building a Better Bay Area reporter Leanne Melendez is here with a full picture of what Living Proof is all about. Some really powerful testimonies there.
Yeah, and we hear about on-demand treatment, and that is so important because it means that when you're ready to do it, let's say I'm now, it has to be now, not 4 hours later, not the next day. Because as we know, the fentanyl crisis has redefined drug overdoses in a way never before seen with other opioids. And San Francisco has thrown money, resources, time, and energy to not so much solve the problem, but get a handle on the number of deaths caused by fentanyl.
Last May, we followed the health department's night navigation team as they offered people on the street a consultation with an on-call doctor who could prescribe medication and offer treatment to try to get them off fentanyl and other opioids.
In the morning, can we help you pick up the medicines, or do you want us to try and get them delivered to you if we can?
Whatever you can do, yeah, that'd be fine.
In 1 month, we have over 300 prescriptions that we were able to prescribe, and 9 people to rehab.
A month later, the number of accidental overdoses dropped and continued to remain lower. So far this year, from January to September 2024, the number of deaths related to an accidental overdose was 504, whereas last year during the same period, the number reached 631.
We have also learned that people do want treatment and do want help. And what we have learned from our evening programs is that people are coming into care and stabilizing.
But there are still empty beds, meaning people are not showing up at detox or residential treatment programs. That shows taking that first step for treatment is difficult. Ask anyone on the street.
I'm sorry, I couldn't help but notice this. What is that?
A syringe.
A syringe with fentanyl?
Yeah.
We had a candid conversation with Abby Moe, who told us she's glad the price of fentanyl has gone up significantly in recent months. That way she's been able to cut back.
I do like a $5 thing I have it a day. Yeah.
But it's not enough.
Yeah, $5-10 is enough. Yeah. That's why I like it. It's easier on your body because you don't have to do so much.
At the moment, she's not ready to seek treatment.
How many more are in need of that? I mean, do you have a number? You must have a number of people who are addicted on our streets in fentanyl.
So we don't have an exact number.
A ballpark.
We think there are probably several thousand.
Through billboards, the health department is now also counting on others who have been in the trenches to say that recovery is possible. People like Siobhan Allen, once addicted to heroin, who never had a mentor to help during her recovery. She now wants to be that person.
Anyone that's struggling with addiction, you tend to isolate. You have shame, and you don't really want to. You don't want to let people know what's going on. Eventually, you can't hide it any longer.
Could I just say, as a reporter who has been on the streets for a long time, you do get tired. of seeing this crisis here on the streets.
It is a crisis that, for those of us who've been working in this field, as I have for more than 20 years, the scale and seriousness that fentanyl has brought to our city and our country really has challenged us to do more and to do better and to rethink how we do things. And I think holding the hope and the possibility that this can be different and will be different is what keeps us going.
And that campaign wants to direct people to their 24/7 call center. You call that number and it gives you the option to connect with a medical professional like the ones we saw on that night team. And it's working, that night team. So they've expanded the hours. Yeah,
Such
it's amazing.
tough work.
Yeah, I call it hard and fast. Fast to get addicted and hard to get off.
Yeah.
Thanks.
And a
Leanne.
struggle, too, for so
Yeah.
many.